Welcome everyone. Today is November 12th, 2019, and today is Veterans Day. And on behalf of the EKU Doctor of Nursing Practice Program, we wanted to share a little bit about practice, about encountering veterans in your clinical practice, and we're recording this so that you can share it with other people that may find this of value. So a quick background statement: the EKU Doctor of Nursing Practice Program is a practice-focused doctorate, and our mission is to prepare nurses at the highest level of clinical practice so that they can lead change to improve health outcomes for the patients and the populations they serve. One of the very special populations that we all get to serve is our veterans. And as I say veterans, I extend that also to our active duty members and then extend it even further to their families, all of which, is ultimately housed in this population that we call veterans. And one of the special things about population health is that we talk about the idea of bringing healthcare to where people are in the community, where these populations exist in the community. And one of the common myths about veterans is a lot of healthcare providers and even other people assume that all veterans get their health care through the Veterans Administration or the VA, and that is not true. A very big majority of veterans do seek assistance with health-related issues outside of the VA system. And so the purpose of this is to kind of give you some pearls about what to do in the practice setting if you're encountering veterans, their families, active duty members, especially outside of that VA context. And quickly, what qualifies me to speak about this is I'm a veteran. I was a nurse in the Navy, and I'm also the granddaughter of a 100% service-connected amputee. My grandpa was a World War II amputee. And I should say that my ex-husband was a Marine, and we commonly used we had a lot of issues with accessing healthcare for him, especially for mental health, after he served several combat tours in Iraq. So all of that, and on top of, I'm a family nurse practitioner. I do primary care, so I very commonly encounter veterans in my clinical practice and just want to share with you some of the things that you need to know as you work with this population. So I've got 3 tips for you, and then I'm going to provide a website that you can follow up on. So tip number 1, when you're working with veterans in a community setting, is you've got to develop rapport. Veterans tend to be very distrusting of people who are not veterans, or people who have not been in the military, or people who don't feel like people know what they're going through. So one of the very important things is that if you've got that connection, maybe you've got a family member that served, or maybe you're a veteran or something, it's important to share that with them, that therapeutic use of self, so that rapport is, number 1, developed more easily. But even if you have never served in the military, or you don't really know a lot about the military, having some patience with them, getting them engaged in conversation, so just those open-ended questions, it can take a lot of time to develop rapport, because in general, they've often been through a lot. They don't feel that you know what they're going through. And so just be patient, because developing rapport can take a little bit of time. Tip number 2 is ask about their families and their support systems. Families, if you're a family member of someone serving in the military, or a veteran, or someone who's been through a lot of trauma like that, I would argue that there is a battle that these family members fight as well, in terms of what are the resources for the families. And so when you are in a community situation where you are close to or near a military base, regardless of whatever branch of service you're in, there's often a lot more resources for families when you get closer to military installations. As you get off active duty and as you transfer back to civilian life and things like that, resources, especially for family members, and that support that family members might experience, kind of diminishes. And simultaneously, as the veteran moves away from that military community, this is often one of the triggers that starts to set off issues mental health issues, just other issues, because the veteran themselves is also losing that context of community. So especially knowing what's in your area in terms of the VFW Club, the American Foreign Legion, what are the military community resources in your area? That's an important thing to know from a community health perspective, because one of the things you want to try to do is to connect veterans and their families. You want to be able to hook them back up with local resources in the area, and online groups are a great way to do that as well. I think in my service time, I've seen a lot of explosion of that, different groups in online context, but knowing your local resources is very important, not just for the veteran, but also for the families. The families experience a lot of trauma from the separations. They experience a lot of trauma from the sometimes the anger and the backlash that can go along with veterans. So these family members need our support. And our last trick thing that I want you to know, and I'm going to share my screen if you're watching this online, is I want you to know about a resource, and it's called Have You Ever Served in the Military? So this is an initiative that was developed from the American Academy of Nursing. It's been out several years now. I know I've talked about this since about 2013 at least. But what this is it's a way to teach people who may not be familiar with the military how to start to engage veterans in conversations. And it also is a quick cheat sheet if you don't know about conflicts of different military errors, things like that. So if you're seeing patients and you need that kind of down and dirty about how to interact with the military, this is a wonderful resource for any healthcare professional just to know better about how to interact with our service members. So for example, this is the home page, and it's got a tab at the top that are veteran resources. So quickly under veteran resources, it's got just some links that are state by state. So you could click on your state and learn about some of your state resources. This is the part that I want you to know about as a healthcare professional, if you're watching this, is this cheat sheet. And you can actually get a pocket card of this, and I would recommend that you get a pocket card. They have posters that you can put in your exam rooms and on the wall, but it's asking the question, this first question, have you ever served in the military? And if the answer is yes, what's wonderful about this resource is it is guiding you through the questions that you need to ask a veteran with the military history. And it's going to guide you through it in a way that's using the right language. It's going to help you get to what might put this veteran at risk of their healthcare problems. So for example, when did you serve? It's very important that we know their service time, because that might lead into exposures or other things this veteran has been involved with. Which branch did you serve in? And so that's where we're asking, were you in the Army, the Navy, the Marine Corps, Air Force, Coast Guard? What branch of the military were you in? And what did you do? What was your job when you were in the military? Now, the Army and Air Force tend to call the job your MOS. The Navy and Marine Corps tend to call the job a designator. Those are kind of fancy words that you might need to know, but the common word is, what was your job? What did you do? Because if you were in the Navy and you were a mechanic serving in the bow of a ship, you might have problems with exposure to chemicals or something like that. If your job, I actually saw a veteran yesterday, and he was telling me that he was in the 101st Airborne. And so he's an older gentleman now, but he's got back problems, knees problems, because he had all these impact landings doing jump training when he was in the parachute infantry. So just things like that. Were you ever in hostile combat? It's kind of leading you through these key questions that you would need to know about a veteran and what they did. It's also asking, do you use the VA for your health care? Again, you would be amazed at the number of veterans that do not utilize the VA for their health care. Sometimes they become frustrated. Other times their military service may not qualify them for full use of the VA. So let me explain that very quickly. I'm a veteran. I was in Operation Iraqi and Enduring Freedom. But when I was on active duty, number one, I did not suffer any combat-related injury or mental illnesses. And I did not serve my 20 years in the military. So therefore, even though I'm a veteran, I do not qualify for any health services through the VA. Now, I do get other benefits from the VA, like I can get a low interest home loan and I can get burial services. And there's other things that I do get. But remember that what you did and how long you served and what you were exposed to is one of the big things that determines if you qualify for health benefits through the VA. And so it's a very different kind of thing. The other things that you might ask about, and these are just some of the big issues for all veterans: post-traumatic stress, that kind of goes without saying, military sexual trauma, blast and concussion traumatic brain injury, because our enduring Iraqi freedom, even some of our Gulf War guys, Operation New Dawn, some of the other things, other groups of veterans that we've got. You all have heard the IED blast or the improvised explosive devices, blowing up Humvees, things like that is a big deal. So traumatic brain injury is a big deal for these veterans. Now, here's what I really love about this form. If you're not really familiar with military history, this is kind of your cheat sheet of some of the health problems that we have seen emerge out of certain eras of military service. So, for example, if you were in World War II and you were anywhere in Japan, you probably are at risk of radiation exposure because of all the nuclear weapons. Likewise, if you were in Vietnam or Korea, there was a high utilization of Agent Orange, which caused all of these health problems. I was stationed at Camp Lejeune as one of my duty stations, so I am very familiar with the Camp Lejeune water contamination problems that went on. We saw a lot of veterans, but basically what happened with that is there was no regulation about dumping certain chemicals into the ground at Camp Lejeune, and as a result, anybody that was stationed on base, even their families, even the families, during this time could have been exposed to some of these conditions. So at any rate, this is a wonderful cheat sheet of when you've asked that question, have you ever served? What time frame did you serve in and what was your job? What did you do? This might clue you in to some of the healthcare problems that these veterans might have. And last but never least is the concern about suicide among veterans. And when you are outside the VA, I can tell you from a primary care perspective, I've absolutely had veterans in my office that are at risk of suicide or actively contemplating suicide. So these are just some of the observation cues that you might hear them say that they're having problems with paranoia, despair, social withdrawal, things like that. And this is a crisis line. It's a 1-800 number, 1-800-273-8255 is a phone number that you can give them, or you can call it right there while they're in your office so that you can get that guidance about how to help them and what to do for them. But suicide is and probably will continue to be a very big health concern for this population. So knowing what to do as a healthcare provider or just even a person in the community is an important thing to know as you interact with your veterans. So again, these are the intake questions that are real. It's a really great resource. There's pocket cards, there's posters that you can get. There's a clinician pocket card, and then there's a poster. My current employer doesn't like posters on the wall, but when I got to decorate my own exam room, I had this on the wall, just like right now at EKU, we're having this initiative about inclusion, and there's some little stickers that we're putting up to show that we're sensitive to certain things. I think that having something like this on your wall is a way to show as a clinician that you are sensitive to veterans and that you're willing to talk about some of the things that they might need. And so this tab about just kind of explains some of the sponsors. And then here, if a veteran is clicking on this, you know, they want to know more about their story, you know, and so a veteran can also fill that out. So in summary, you know, population health is an important initiative that aligns with the Institute of Medicine, the Future of Nursing report, all of these initiatives that we have in healthcare. So if you are someone who might encounter a veteran in the community, which you're going to if you're a healthcare provider, just appreciate that this veteran may not be accessing or utilizing health services from the VA. So what can you do to help? So the number one thing is develop that rapport. Always ask about their families and support systems. Be very sensitive to the potential for suicide. And last but not least, print and download this resource called Have You Ever Served in the Military as both a conversation starter and as a way to guide you through conversations with veterans. If there's further questions, you're welcome to contact me. My name is Dr. Molly Bradshaw. I'm the coordinator for the DNP program. My email at EKU is molly.bradshaw@eku.edu. And feel free to share this link with anyone that you might know of. I think this is a resource that we all need to know about. I'll leave this video public on YouTube so that you can share it at any point. And we hope that if you have any further questions about the EKU DNP program, you can contact us. But today is really about saluting our veterans and just putting the word out that at EKU, we are very much in support of both veterans and their families. So have a great day. And if you have any questions, I'll look forward to hearing from you.